Hey everybody, this is Module C, the Residence Environment, Safety and Emergency. The objectives for this lecture, we want to make sure that we explain why residents in long-term care facilities are at more risk for injury. We want to identify the role of the nurse aide in maintaining a safe environment for the resident and describe the role of the nurse aide in dealing with emergencies in the healthcare setting. So when we're talking about safety in the resident's environment, what we mean is when a resident has little risk of injury or illness in the environment in which he or she lives. The resident's environment is the area in the long-term care center that the resident calls home. It's designed to provide comfort, safety, and privacy for that resident. And keeping in mind that this could be a private room, or a lot of times we're talking about a shared room. In the long-term care facility, in the nursing home, the resident unit is going to be furnished and equipped to meet basic needs. They're going to have personal space, furniture, and equipment that are provided for the resident by the long-term care facility. And this is going to include a closet and some drawer space, a bed, which may be electric or manual, a call system, overbed table, bedside stand, chair, and a privacy curtain. We're also going to provide them with personal care items like a bedpan, wash basin, soaps, hair care supplies, deodorant. And it's going to be located in those items will be located and put in the resident's unit. Usually that's either going to be at the bedside stand, but sometimes some of the bathroom areas will have a space for those as well. It may also, these resident rooms or units may also contain some of the resident's choice items from home. They may, if they have room, they may bring a recliner, pictures, their own bedspreads, pillows, etc. When we're talking about hazards now, this is anything in the resident environment that may cause illness or injury. So this could be an example, poisoning, suffocation, equipment, a fire hazard, falls, and these are things that we need to be paying attention to, especially, I like to use an example. You know, if you have two residents in the room, one of them has some Alzheimer's or dementia, and then you have her roommate who loves to paint her nails once a week and change the colors. Well, if she has her nail polish remover sitting out on the table, you know, it's in this little container, it's pink, it's cute. Maybe the resident who's confused thinks it's pink lemonade, and they go over and they take a big old drink of this nail polish remover. Well, that's going to be a hazard, of course. So we might have to look at things a little differently and look at hazards a little differently than we used to, or than we would outside of the long-term care facility. So the importance of safety in the resident's environment. OBRA and regulatory agencies require that long-term care facilities follow specific safety procedures and policies. The facility is home to the resident, and the resident should be encouraged and assisted to making it as home-like as possible, to add their personal touches. But safety is also a basic need of the resident, and residents are at a greater risk for accidents and falls while in the long-term care facility. The goal is to keep residents safe without limiting their independence or their mobility. So elderly residents are at a greater risk for injury and rely on us to help keep them safe. There are several reasons that could put an elderly person at higher risk for injury, and there's a few listed here. We've got increased knee joint instability as we age, decreased strength, slower movement, medication side effects like dizziness, drowsiness, etc. And it's more likely to be on more medications as we age. I mean, not always, of course, but when you combine different medications too, this just increases those risks of side effects. Lower blood pressure. And remember that our residents are relying on us to keep them safe when they're in our care. In addition, some other factors that make them higher risk for injury, impaired coordination for various health reasons or physical reasons, hearing impairment, visual impairment. Some people may have cognitive impairment like Alzheimer's or dementia, some reduced smell and touch. All of these things together can put these clients at higher risk. So our role as a nurse aide is to maintain a comfortable room, and that includes comfortable temperature, good lighting, Be aware that the resident may prefer a warmer room temperature than the employees. And this is definitely true in my experience at the nurse. It's definitely kept warmer than what I would choose for my own space. Be aware that the residents might have poor vision and need bright light for reading. We want to help to keep the unit clean, dirty items disposed of properly. Now keep in mind, this is their home and this is their space. We want to help them and assist them to keep it clean and tidy, especially if we're bringing in supplies or things. But we want to make sure that we respect their space as well. So we always want to ask before we start trying to clean up the area if it's okay if we do certain things. Oops. All right. So let's see. Oh, I did skip one. Sorry about that. So safety in the residence environment. Another role that we have is to identify and report unsafe conditions or faulty equipment. We also want to allow residents choice, if possible, in the arrangement of their personal items. This is going to help them. I mean, they know what works for them. They know what's easier for them. So if they prefer to have their walker in this location versus this location, let them have some say and choice in how it's arranged. We also want to make sure to check linens for personal items before sending it to the laundry so that their items don't get lost or damaged. When someone is on oxygen, we want to make sure that there's an oxygen in use sign. It's really important not to have open flames or smoking in any area where there is oxygen, and also want to make sure that electrical equipment in the room is safe and that we're not putting any other additional electrical equipment in the room without getting it approved first. So a few things to remember. We want to make sure that we are providing the right care to the right resident. That's obviously always important and a big safety concern. We want to always keep beds in the lowest position unless providing care, because we do need to raise beds to protect our own backs and bodies, but we never want to leave a bed in a high position. We want to arrange the resident's room in a way that's convenient for the resident to foster independence. We want to make sure they always have their call bell or call signal within reach. And per OBRA guidelines, rooms need to be kept between 71 and 81 degrees in temperature. Whenever we're transferring a resident into or out of a bed or a wheelchair, we need to always make sure that those items are locked before we move the resident. We want to be careful when transporting residents as well in wheelchairs so they don't bang their feet up against something and cause them an injury. We want to consider the over-the-bed tables as clean areas, and it's part of our job to help make sure that these remain clean and free of clutter. And of course, respect the residents' right to full privacy, whether that be using the curtain and the door or the curtain. Respect that we want to make sure that we respect that the residents have and use their personal items, and like we've said before, we want to encourage this. We always check the water temperature before giving a bath or shower or foot care or whatever it might be. What feels good to us might not feel good to them. We don't want to burn somebody. If water in the facility in general seems too hot, you want to make sure that this is reported so that it can be monitored. And then finally, monitor wandering residents and make sure that they're safe. And not only keeping themselves safe, but keeping other residents and clients safe as well. So when we talk about falls, a fall is unintentionally coming to rest on the ground floor or other lower level. It's any sudden, uncontrollable descent from a higher level to a lower level, which may result in injury. 1 in 4 Americans aged 65 or older falls each year. And every 11 seconds, an older adult is treated in the emergency room for a fall. Every 19 minutes, an older adult dies from a fall. So it's not something to take lightly. This is something that we really need to make sure we're aware of and keeping our residents safe. And I have some other statistics here for you as well. Falls are the leading cause of fatal injury and the most common cause of non-fatal trauma or trauma-related hospital admissions among older adults. In 2015, the total cost of fall injuries was $50 billion. Medicare and Medicaid paid 75% of those costs. Each year, in a typical nursing home, they report 100 to 200 falls per year, and this is probably higher because not all falls are reported as they should be. Of the 1.6 million residents in long-term care facilities, approximately half fall annually. About 1 in 3 of those falls, or of those who fall will fall again. And 1 in every 10 residents who falls has a serious related injury, and about 65,000 patients suffer a hip fracture related to a fall each year. So facilities are going to have fall prevention programs. Every facility should have one in place. The components of a fall prevention program include assessing the residents' risk for falling. You may put them, for example, at high, medium, or low risk of falling. Identifying and implementing interventions to minimize these risks. Identifying and implementing interventions to minimize the risk of sustaining injury should a fall occur. An example of this might be if we have a patient who is a high fall risk, their bed may be kept at ground level essentially, and in addition, they may have a padded floor mat right next to their bed. So if they still do happen to fall, less likely that they're going to get an injury. There are both intrinsic and extrinsic factors that put you at higher risk for falls. Intrinsic factors are those risk factors that result from the resident's inner being. Extrinsic factors are those risk factors that result from those things that are outside of the resident. And I'll give some examples. So intrinsic risk factors: age, being 65 years and older, having certain medical conditions and diseases, or a combination of multiple medical conditions and diseases, a decline in function due to inactivity, and effects or side effects of medications. Whereas the extrinsic risk factors, these are ones that are sometimes more within our control as nurse aides. These are hazards of the environment, like poor lighting, clutter, a wet floor, equipment that is unsafe, like wheelchair brakes that aren't working, or unsafe or inaccessible personal items, like shoes that don't fit correctly, or having your walker on the other side of the room that you have to get up to go get. So we can do a lot of things to prevent falls. Assistive devices, using these like gait belts, canes, and walkers, handrails, which are located in the hallways and stairways, and making sure that those handrails are in that side of the hall is kept clear. Because if you don't have access to it, you're not going to be able to utilize those assistive devices. Grab bars in bathrooms and showers, wheels locked on beds and wheelchairs, for example, and beds that lower to the floor when necessary. So as a nurse aide, we can assist with ambulation if necessary. We can provide appropriate assistive devices or supportive devices and supervision, keep environments free of clutter, keep walkways free of rugs, cords, boxes, vital sign machines, equipment, and observe frequently. If we notice unsafe conditions, we need to be reporting these. We also need to ensure that residents always have their call light within reach. We need to answer call bells promptly position residents in chairs or wheelchairs or beds so they don't slip out, fall out. If there's any spills, we need to clean those up immediately. And of course, pick up any trash or hazards on the floor and either put them away or put them in the trash, whichever is appropriate. Another safety concern that we need to think about is elopement. This is when a resident leaves a healthcare facility without the staff's knowledge. This puts patients at risk of exposure to heat or cold, drowning, getting hit by a car, dehydration. Facilities need to have a plan in place in case a resident elopes. We can prevent elopement by identifying residents who are at risk. So for example, a resident who has a history of wandering. Assign a newly admitted resident to a room away from exit and increase staff awareness of the risk of elopement so that they can, be more diligent in keeping a closer eye on these new residents. Elopements tend to occur within the first few days of new admission to a facility. And also technology, we get to utilize that now, right? So locked doors with keypads that only the staff have the codes to, having cameras at the exits. Some residents will have bracelets that actually help to alert when a resident gets too close to a door or is leaving through a door, and those can all be helpful in preventing elopement. Other emergency situations that we may come across are medical emergencies, right? A medical emergency is a dire situation when a person's health or life is at risk. And we're going to talk about some of the more common ones that we may see in different facilities or in the nursing home. A cerebrovascular accident. This is a CVA. You may have heard it called a stroke. This occurs when the blood supply to the part of the brain is blocked or when a blood vessel breaks and leaks in part of the brain. This is a true emergency because a quick response is going to reduce the severity of the incident, and it makes it more likely that we're going to have a recovery from this. An important acronym to remember when we're talking about CVAs or strokes is BFAST, okay? So this can be used to remember the sudden signs that a stroke is occurring. Balance, loss of balance, dizziness, eyes, having blurred vision. Face, one side of the face is drooping. Arms, if there's weakness in one arm or one leg. Speech, if you're having difficulty with speech or slurred speech. And time, that means it's time to call. If you're seeing these symptoms, it's time to call 911 and get help right away. Seizures are another medical emergency. This is defined as the involuntary contractions of muscles, a small area or the entire body caused by an abnormal electrical activity in the brain. The main goal of someone's having a seizure is to keep them safe. What's also really important when someone is having a seizure, or we think someone's having a seizure, is to note the start and finish time, okay? So if I'm in my room and my patient begins to seize, or what I believe may be a seizure, I'm gonna make a quick note of what time it started, and then when they stop, I need to note that as well. If I'm in the room when someone begins to have a seizure or when someone is having a seizure, I need to get the supervisor or the nurse, but I need to stay with the resident. Ideal situation is that you hit that call button and someone answers and you ask for help to come. You know, if you need to, if someone's not answering the call bell, if you can say out into the hall, if someone could please come in here and help. I want to put on gloves. We want to protect the patient's head because if they're having a seizure, we want to protect them from getting further injury. And loosen clothing so that they don't have any trouble breathing. And if we can, we want to roll that patient onto their side. We don't want to restrain the resident or restrict their movement. That can actually cause more injury. It's old, you know, they used to say to put something between the teeth. That is not something we want to do. Do not force anything between the teeth. Definitely don't give foods or liquids or they're going to aspirate. And if no injuries are suspected, like I mentioned earlier, that's when you're going to want to turn them onto their side. Just in case they vomit. That way they're, again, lowering their chance of aspirating. If we have questions of whether they fell and maybe cause injury to their head or spinal cord, we're not going to want to move them onto their side quite yet until a nurse has come in and been able to assess. So choking, and this is the conscious choking resident. A common sign that a resident is choking is when they put their hands around their throat. This is a universal sign, right? If this person is conscious, the best thing we can do is encourage the resident to cough and cough forcefully. Again, stay with this person. Do not leave them, but get help. There are things that we can do to prevent choking. One of the main important things is making sure the resident is sitting up between 75 and 90 degrees while they're eating and leaving them up to 75 to 90 degrees for at least 30 minutes after they've completed their meal. We also want to provide assistance at meal times as needed to prevent spilling of hot liquids, make sure they're using their dentures because that's going to help them to chew, assist them by cutting food into smaller bites, and if you notice any difficulty chewing or swallowing, make sure that that is getting reported immediately. Another hazard that we may come across, hopefully not, but is a fire. Fires need three things to live, right? They need heat, fuel, and oxygen. Fires can be prevented by removing one of those elements. That's going to help to put the fire out. Every facility is going to have a fire safety plan. All employees must know the plan before it's needed, or it's going to be chaos, right? There are often in-services about fires and evacuation. Evacuation routes are posted, and there's fire extinguishers throughout facilities. It's important for you to review fire safety plans often and understand your role in the event of a fire. Now, if a fire does happen, some of the rules that we all have is to keep calm, follow our facility's fire safety plan, never use an elevator, and remember these two acronyms, RACE and PASS. So we're going to go over those. These are important. So RACE, remove residents from danger. Activate the alarm. Contain the fire by closing all doors and windows if possible. Extinguish the fire, or the fire department will extinguish. PASS. This helps us remember how to use the fire extinguisher. So PASS, pull the pin, aim at the base of the fire when spraying, squeeze the handle, and sweep back and forth at the base of the fire. And we will have our first aid, our CPR class on the coming up, and that's going to be when we will review some of these other hazards and concerns, emergencies that may come up, and we'll get more practice with that. If you have any questions, let me know.